I've been seeing Miss Bennett for approximately 6 weeks. She was referred to me through patients that I've operated on before that she knows, friends of hers who've had the XLIF. As I recall, Miss Bennett has had 2 years of increasingly severe back pain. She has somewhat of an unusual problem in her spine in that her spine is very weak. The one vertebrae has moved in front of the other one and is causing significant compression of the nerve sac, as well as every time she moves, she essentially has bone grinding against bone, causing her rather severe pain. No wonder why she's been having a difficult time doing her tap dance routines. She's been through physical therapy, she's been through injection therapy, she's been taking increasing doses of narcotics and pain pills, fortunately none of which have really given her the relief that she needs to allow her to do her normal activities of daily living, as well as return to her passion, which apparently is tap dancing. For Mrs. Bennett, what we're finding in patients with similar conditions is that we would expect her to have a quiet night in the hospital. The following morning we'll start mobilizing her. I usually ask my patients to wear a back brace for the first month after surgery, more as a sort of a belt and suspenders to just remind the patient not to do sudden motions while her muscles are healing and the bones and the surgery itself is healing. We will expect her to begin an outpatient therapy program 2 weeks after surgery, where she will undergo a graduated increase in physical activity. And I would hope by 6 to 8 weeks after surgery she can start some soft shoe.
I've had pain all my life. When I had heard about all this from the doctor, I thought, oh, I'm going to have some relief. And my kids, when they call me, they say, how's your back, Mom? And I said, well, I think I've found the man to go to. He's very, very good about what he's doing.
The XLIF procedure is the first time in my practice where a minimally invasive technique is easier on me, saves me time, and is better for the patient than an open procedure. The XLIF is a novel procedure that allows us through minimally invasive techniques without cutting through muscle to get to the spine and do reconstructive surgeries through essentially outpatient procedures. As an example, 20 years ago when I first began an interest in spinal surgery during my training, to do a lumbar reconstructive surgery at a single level was a 12 to 14 hour case. Patients were staying in the hospital for a month or more, remaining in a body cast for several months, and the results weren't that good. What is different is that by going in and doing minimally invasive techniques, we're still able to do those same open procedure results and using much less invasive techniques. Again, a significant improvement. One of the ways we're able to do that is not just the fact that we've thought of this surgical corridor procedure, but it's really an integrated system. It's the new special modified retractors. It's neural monitoring that we're able to stimulate and keep real-time feel for where all the nerves are and how they're functioning during surgery. Working with our anesthesiologists for different techniques they have to use. All these things together give us an integrated platform so we're able to deliver this care that 2 or 3 years ago we really would have had a difficult time doing. We're doing the same procedures now, and in an hour or two, patients are sometimes leaving the hospital in several hours after surgery, and we're seeing tremendous results as far as pain relief and return of function. With this technique, we're finding we're helping these people we were not able to help before. When Mrs. Bennett returned at 2 weeks, she was doing extraordinarily well. She had very minimal postoperative pain. Her ability to get up and do simple things for herself was greatly enhanced by the procedure we did. 5 weeks from her surgery, she probably went to about 2 or 3 weeks of formal physical therapy. They stopped going to formal physical therapy because I believe they went on a cruise. And obviously well enough to do it on a cruise, she probably doesn't need the therapy. Today, the x-rays we saw in my office showed that the fusion already shows bony deposition and healing. For a woman her age, for our standard types of procedures for this, I might not expect to see that bone growth for a year or two.
It's wonderful to be able to just get over and get up and get going. I really am glad that I was able to take this surgery that the doctor gave me.
She is doing a lot of things without holding her back. She's walking better, she's sitting better, she's sleeping better, And the big thing is her whole demeanor is different because she is pain-free. The thing we're experiencing now is little daily types of things, anywhere from getting out of the car to getting out of a chair is so much easier and, again, pain-free, that it's changed her quality of life, improved it dramatically. And again, while we were hoping this was going to happen, it happened a lot faster than we thought it was going to.